Hello, everybody, and welcome back to the Average Joseph podcast. Before I begin, I want to be completely transparent with you. So, as always, my name is Joseph. I'm a certified social worker with experience supporting individuals and families navigating neurodiversity. However, I'm not a medical doctor, a psychologist, or a licensed diagnostic clinician. Everything presented in today's episode is compiled entirely from publicly available reputable sources, including the latest reports from the Centers for Disease Control and Prevention, which is the CDC, the DSM-5-TR Diagnostic Manual, peer-reviewed research summaries from major health institutions, and guidelines from autistic-led organizations. This content is created purely for educational and informational purposes. It's not medical advice, nor is it a substitute for professional evaluation, diagnosis, or treatment. If you or a loved one have concerns about autism spectrum disorder or any developmental or mental health matters, please consult a qualified healthcare provider, developmental pediatrician, or licensed specialist for personalized guidance. With that important clarity out of the way, thank you for joining me. Let's begin our comprehensive, respectful, and in-depth exploration of autism spectrum disorder. Today we're going deep into autism spectrum disorder, or ASD. This isn't a quick overview. We're talking history, the full diagnostic picture from the DSM-5-TR, every stage of life from infancy through adulthood, the latest 2025 prevalence data, causes, co-occurring conditions, myths we need to bury forever, incredible strengths that often get overlooked, neurodiversity affirming supports, workplace and school accommodations, and much more. Whether you're a parent, an educator, partner, colleague, or someone who's wondering if this might describe you or a loved one, this episode is for you. We'll celebrate autistic voices, honor the neurodiversity movement, and give practical, respectful tools to support autistic people without trying to fix who they are. Again, this is for education and understanding only. It is not a substitute for professional medical or diagnostic advice. If you have concern about yourself or a child, please see a qualified healthcare provider or developmental specialist. If you're new here, hit that subscribe button and let's make the world more inclusive together. Grab a notebook if you want. There's a lot of ground to cover. To truly understand autism today, we have to look back. The story begins in 1943 when child psychiatrist Dr. Leo Kanner published the first detailed description of what he called infantile autism. He wrote about 11 children who showed extreme preference for solitude, repetitive behaviors, and challenges with social connection. Around the same time, Hans Asperger in Austria described similar patterns, though his work wasn't widely known in English until much later. For decades, autism was misunderstood, sometimes confused with schizophrenia, sometimes blamed on refrigerator mothers. It wasn't until the 1970s that researchers proved it was a distinct neurodevelopmental condition with strong genetic roots. In 1980, the DSM-3 finally gave autism its own official category as infantile autism. The DSM-4 in 1994 introduced a spectrum with separate labels like autistic disorder, Asperger's syndrome, EDD, NOS. Then came the big shift in 2013 with the DSM-5. All those labels merged into one unified autism spectrum disorder. The 2022 text revision, which I'll refer to as the DSM-5-TR, made a small but important clarification, emphasizing that social communication deficits must be present in all three sub-areas. This evolution reflects what we now know. Autism isn't rare or narrow. It's a broad, natural variation in human neurology that has always existed. Understanding this history helps us see why early diagnoses were missed, especially for girls, women, and people of color, and why today's awareness is so vital. What is autism spectrum disorder? According to the CDC, autism spectrum disorder is a developmental disability caused by differences in the brain. Some people have a known genetic condition linked to it. For many, the exact causes are still being researched. The key word is spectrum. No two autistic people are exactly alike. Autism affects the way a person communicates, interacts, learns, and processes sensory information. It begins before age 3 and lasts throughout life, though how it shows up can evolve with age, support, and environment. Importantly, there's nothing about a person's appearance that tells you they are autistic, and this is crucial. Autistic people are not broken or less than. Their brains are simply wired differently, often with remarkable strengths alongside challenges in a world built for neurotypical brains. So let's get a little more precise. To receive a diagnosis of autism spectrum disorder under the DSM-5-TR, a person must meet criteria in two main categories with symptoms present in early development that cause significant impact in daily life. First, criterion A, persistent deficits in social communication and social interaction across multiple contexts, manifested by all three of the following. 1. Deficits in social emotional reciprocity. For example, trouble with back and forth communication, reduced sharing of interests or emotions, or difficulty initiating or responding to social bids. 2. Deficits in nonverbal communicative behaviors. Things like differences in eye contact, body language, gestures, or facial expressions that feel natural to the person. And 3, deficits in developing, maintaining, and understanding relationships. This means adjusting behavior to different social contexts, sharing imaginative play, or making friends in typical ways. All right. And then we got criterion B, restrictive, repetitive behaviors, interests, or activities, and at least two of the following. Stereotyped or repetitive motor movements, use of objects or speech. 2. Insistence on sameness, inflexible routines or ritualized patterns. 3. Highly restricted fixated interests that are abnormal in intensity or focus. 4. Hyper or hyporeactivity to sensory input or unusual interests in sensory aspects. Symptoms must have been present early, though they may have been masked or not fully obvious until social demands increase, and they may cause clinically significant impairment. The diagnosis also includes specifiers with or without intellectual impairment, with or without language impairment, associated with a known medical or genetic condition, associated with another neurodevelopmental or mental disorder, or with catatonia. Clinicians also assign a level of support needed. Level 1, requiring support, often what used to be called Asperger's, high masking, independent, but needs help in some areas. Level 2, requiring substantial support, and level 3, requiring very substantial support. These levels aren't fixed labels. They can change with environment and support. Many autistic adults prefer identity-first language, such as an autistic person, because it's part of their identity. Others prefer person-first, always ask the individual. Signs and symptoms across the lifespan. Let's walk through how autism can look at different ages using the CDC's detailed milestones and red flags. Remember, every person is unique. Not everyone will show every sign, and some signs can be subtle. Infancy and toddlerhood, which is 0 to 24 months. By 9 months, does not respond to their name, does not show facial expressions like happy or sad. By 12 months, few or no gestures, no waving goodbye, no pointing, does not play simple games like patty cake. By 15 months, does not share interests, doesn't show you a favorite toy. By 18 months, does not point to interesting things, limited pretend play. By 24 months, doesn't notice when others are hurt or upset, limited 2-word phrases. Many autistic toddlers engage in repetitive play, have intense focus on objects, or show sensory sensitivities, covering ears at loud sounds or loving certain textures. Some hit milestones, then regress around 18 to 24 months. Preschool and early school years, ages 3 to 8. Challenges with back and forth play, lining up toys, scripting favorite TV shows, distress at routine changes, hand flapping or rocking, stimming, which is often self-regulating and helpful, unusual reactions to sensory input. Socially, they may prefer parallel play or have deep knowledge about one topic. School age and adolescence. Friendships challenges may shift to difficulty reading sarcasm or unwritten social rules. Intense interests can become assets in clubs or academics. Sensory overload in noisy classrooms or bullying can lead to anxiety. Some teens mask heavily, forcing eye contact or scripting conversations, which is exhausting. Adulthood, especially masking in women and girls. This is where many diagnoses happen later. Research shows autistic women and girls often camouflage or mask symptoms more effectively, mimicking neurotypical social behaviors, rehearsing scripts, suppressing stims, forcing eye contact, or people-pleasing to fit in. This can lead to burnout, anxiety, depression, or identity confusion. Signs in adults might look like extreme exhaustion after social events, preference for solitary routines, deep special interests, sensory sensitivities in the workplace, or difficulty with transitions and executive functioning. Many women describe masking until it blows up. holding it together through school and early career, then crashing in their 20s to 40s with mental health crises. Gender differences exist because diagnostic criteria were historically based on male presentations. Today, awareness is growing and adult diagnoses are rising. The spectrum, variability, and co-occurring conditions. Because it's a spectrum, support needs vary widely. Someone at level 1 might live independently with workplace accommodations. Someone at level 3 might need 24 support for daily living and communication. Co-occurring conditions are extremely common. Studies show nearly 78% of autistic children have at least one additional mental health condition. Common ones include ADHD, anxiety disorders, depression, intellectual disability, epilepsy and seizures, gastrointestinal issues, sleep problems, sensory processing differences, feeding or elimination disorders. These aren't part of autism itself, but often travel with it. Treating co-occurring conditions with respect and tailored approaches makes a huge difference. According to the CDC's 2025 Community Report on Autism, about 1 in 31 8-year-old children in the United States have been identified with autism spectrum disorder. That's up from 1 in 36 in the previous report. For 4-year-olds, identification is also rising. Rates vary hugely by community, from 1 in 19 in California to 1 in 103 in some Texas sites, reflecting differences in screening and services. Autism spectrum disorder occurs in every racial, ethnic, and socioeconomic group. Recent data shows improvements in identification among Black, Hispanic, and Asian Pacific Islander children, sometimes now equally or exceeding rates in white children. It remains diagnosed about 3 to 4 times more often in boys than girls overall, but that gap is narrowing as we recognize masking in girls and non-binary people. The increase reflects better awareness and screening, not an epidemic. Autism has always been here. We're just seeing it more clearly. There is no single cause. Scientists agree it involves complex interactions between many genes and environmental factors that influence early brain development. Genetic factors. Having a sibling with autism spectrum disorder raises risk significantly. Certain conditions like Fragile X syndrome or tuberous sclerosis are linked. Rare mutations and common genetic variations both play roles. Environmental factors. Older parental age, prematurity, low birth weight, maternal diabetes, complications at birth, and certain exposures like air pollution are associated with higher likelihood. Recent NIH initiatives in 2025 are funding large exosomics studies, looking at how genes and environment interact. Importantly, autism begins very early in brain development, long before birth. As of today, vaccines do not cause autism. This myth came from a fraudulent 1998 paper that was retracted. Dozens of large, rigorous studies worldwide have confirmed no link. Let's clear the air on some persistent myths. Autistic people lack empathy. Many feel deep empathy, sometimes too intensely, but may express it differently or struggle to read subtle cues. Autism is a disease to cure. The neurodiversity movement, led by Judy Singer in the 90s, views autism as natural human variation. We focus on acceptance and support, not elimination. Only boys get it. Girls and women are underdiagnosed due to masking. It's caused by bad parenting. This is completely false. All artistic people are savants or geniuses. Some have extraordinary talents. Most are average in many areas with strengths in others. Autism is lifelong, occurs worldwide, and is not preventable by any single actions. Strengths, talents, and neurodiversity movement. Autistic brains often bring powerful strengths, incredible focus, and attention to detail. Pattern recognition, deep specialized knowledge, honesty and integrity, strong sense of justice, creativity, and thinking outside the box. Many excel in science, technology, arts, and advocacy. Famous examples include Dr. Temple Grandin, an animal science innovator who redesigned livestock systems, Susan Boyle, Satoshi Tajiri, he's the creator of Pokemon, and many others who credit their autistic traits for their success. Self-identified autistic voices like Elon Musk and countless unnamed engineers, artists, and activists show the same. The neurodiversity movement, led by organizations like Autistic Self-Advocacy Network, emphasizes nothing about us without us. Autism is not a tragedy, it's part of human diversity. We need acceptance, accommodation, and autistic people in leadership. Diagnosis process. Diagnosis usually starts with developmental screening at well-child visits. The CDC recommends autism-specific screening at 18 and 24 months. If concerns arise, a comprehensive evaluation follows, often using tools like the ADOS-2, parent interviews, and observations. It involves developmental pediatricians, psychologists, or multidisciplinary teams. For adults, many self-refer after recognizing patterns or when a child is diagnosed. Adult evaluations look at child history, current functioning, and ruling out other conditions. It can be life-changing, providing explanation, community, and access to supports, interventions, and accommodations. Early intervention, birth to 3, is crucial. Speech therapy, occupational therapy, and developmental supports tailored to the child's needs. The goal isn't to make someone less autistic, but to build skills and reduce barriers. Neurodiversity affirming approaches, respect stimming, honor special interests as strengths, use visual supports, give processing time, avoid forcing eye contact. Many families and professionals are moving away from compliance-based therapies toward those that center autistic comfort and autonomy. In school, individualized education programs with sensory breaks, quiet spaces, modified assignments, social skills support groups that respect autistic communication styles. In the workplace, which is huge for adults, practical accommodations under the ADA include noise-canceling headphones or quiet workspaces, flexible hours or remote options, written instructions instead of verbal, dimmer lighting or sensory-friendly environments, fidget tools, clear expectations and advance notice of changes, mentorship programs. Many companies are creating neurodiversity hiring initiatives because autistic employees often bring unmatched focus and innovation. For families, parent training, respite care, sibling support groups. For everyone, communicate directly and literally, respect routines, and create low-demand environments when needed. How to be a better ally. Some practical tips. Simple ways to support include believe autistic people when they describe their experiences. Ask before offering help, such as, how can I support you right now? Celebrate special interests. Allow stimming without comment. Give extra time to process questions. Advocate for sensory-friendly spaces in public. Use preferred language. Amplify autistic voices in media and policy. Small changes create big inclusion. All right, some resources and further learning. This also includes the resources drawn for today's episode. The CDC Autism page, Autistic Self-Advocacy Network, Autism Society of America, ASAN's Resources and Toolkits, the books Neurotribes by Steve Silberman and Unmasking Autism by Devin Price, adult diagnosis clinics and local support groups, and then apps such as Milestone Tracker, visual schedule tools. Search for autistic-led organizations in your area. Some quick answers to frequent questions. Is autism increasing? Identification is increasing due to better awareness. Can it be outgrown? No, but support needs change. What about cures or treatments? We focus on quality of life and acceptance, not erasure. How do I talk to my child about their diagnosis? Honestly, positively, emphasizing strengths. Conclusion and call to action. All right, we've covered a lot today. Autism is part of the beautiful diversity of human brains. By understanding it deeply, we reduce stigma, open doors to support, and create a world where every mind can thrive. If this episode helps you understand someone you love or yourself, please share it. Leave a comment with your biggest takeaway. Suggest future topics. Thank you for investing time and learning. This helps make a huge difference. I'm Average Joseph. Keep celebrating every kind of mind. Take care, and I'll see you in the next episode.